Hello and welcome to my video. In this video, I will be explaining the three main energy sources of the MRI machine. I will be explaining them in detail as well as explaining the dangers that are associated with them. So the three main fields of the MRI machine are B0 or BO, the time varying gradient, and time varying RF. So first I'm going to begin with BO. BO is also known as the static magnetic field, and it is the main magnet of the MRI machine, and it's also the most dangerous. How BO works is it aligns a patient's hydrogen nuclei in order to produce an image. And BO's strength is measured in Tesla. 1 Tesla is equal to 10,000 Gauss. So MRI machines can range anywhere from 1.5 to 8T, and that's essentially rating the strength of BO. Now, because the MRI machine is a superconducting magnet, it means BO is always on. So just because there's no indicators that it's on, you can't see it, smell it, anything like that, does not mean that it's not present. So that's why it's extremely important that you scan your patients for ferromagnetic objects before getting anywhere near the MRI machine. Now, the two main dangers associated with BO are the missile effect, which is where, again, ferromagnetic objects in the room essentially become projectiles when they get near the MRI machine, and the rotational force, which is where ferromagnetic objects rotate across the room to try to align with the flux of the MRI machine. So that, of course, is extremely dangerous and will wipe out anything in its path. So next we have the time varying gradient. The time varying gradient is the main acoustic noise of the MRI machine, and this is due to the competing magnetic fields. Now, the time varying gradient correlates with BO because the stronger BO is, the louder the MRI machine is. So again, the stronger BO is, the harder these gradients are working to get those images. Now, the gradients associated with the time varying gradient are the X, Y, and Z gradient. So you have the X gradient to produce sagittal images, Y gradient producing coronal images, and the X gradient producing axial images. Now, again, these gradients temporarily alter and change BO in order to produce images. Now, the main danger associated with this field is hearing loss. So patients are provided with headphones and earplugs for comfort. The FDA has set limits to the how loud the scanner could be while the patient is undergoing the scan. So these are known as acoustic limits. Now, the MRI machine itself cannot surpass 140 decibels max, and the max limit with hearing protection is set at 99 decibels. So the last energy field we have to talk about is the time varying RF. Now, the time varying RF is the main heat of the MRI machine. So RF energy is sent to the patient's tissues during the scan. This excites hydrogen ions producing resonance, hence magnetic resonance imaging. Now we have SAR, which is specific absorption rate. This measures the amount of RF energy absorbed by the patient's tissues during the scan. And we use this, or in order to calculate this, I should say, you need the weight of the patient. Now, the FDA has set regulations for SAR. So we have 3.2 watts per kilogram for the head for 10 minutes, 4 watts per kilogram for the body for 15 minutes. We have 8 watts per kilogram for the head and torso for 5 minutes, and then 12 watts per kilogram for the lower extremities, again for 5 minutes. Now, the dangers associated with the time varying RF are burns, of course, because the RF is the heat of the MRI machine. So we have 3 types of burns. We have an induced loop burn, proximity burn, and the resonant burn. So an induced loop burn is caused by skin-to-skin contact. So that happens when the patient is either crossing their arms in the scanner, putting their hands on their thighs. So one way to prevent this is by placing 0.5 to 1 centimeter thick waterproof pads on the patient. Next, we have a proximity burn, which is from the skin touching the side of the bore. So this can actually cause 3rd-degree burns. So it's important to communicate with your patient, making sure they're okay. To prevent a proximity burn, you would use waterproof pads as well. Lastly, we have a resonant burn, and this is from an active implant. So again, pacemakers, neurostimulators, defibrillators, it's really important that you communicate with your patient, making sure that they don't have anything in them that can cause a resonant burn.